In this video, we will be talking about ways to pursue family medicine, or in general, how you'd pursue med school in the United States, particularly coming from the Philippines. Um, this kind of video is going to be a little different compared to what I usually upload. Um, let's get to it. So, what is a family physician in the first place? So, these family physicians are primary care providers. They are categorized under the category of primary care physicians, along with internal medicine, pediatrics, among other specialties. They're different coming from other specialties or specialists, such as neurosurgery, cardio surgery, if that term is correct. But basically, these kinds of physicians do not perform complex procedures, especially in the operating room. They see patients of all ages. They provide basic care for many common ailments. So that's basically what they do. And basically, if you're wondering where I get my source, one of them is actually from Med School Insiders, led by Dr. Kevin Jubbal. Um, I remember clearly one of the things that he said in this video. Being a family physician, everything that you learn in med school is usually retained once you match into family medicine. Unlike other specialties where you actually learn more and eventually you'd lose some of the information that you've learned and committed to heart back in med school, that's not the case for family med. Sorry, there's a fly. Anyways, so this is basically the salary comparison for various countries. So if you're a family physician in the Philippines, this is your salary. For the US, it's this. Canada, that. Japan, US, Canada, and Japan, their salaries are comparable in the sense that all of them are above 200K. If I'm not mistaken, this is in US dollars. I'm not certain. I made this. I gathered these findings back in 2022. That was like, well, not really 2 years ago, but almost 2 years ago, shy of a few months. So what is the education needed to be a family physician? So of course, your level has to be doctorate, and projected jobs are said to be 18,700. Although this information might change because again, I researched this back in 2022. That was back when I was grade 11. So, what are the minimum requirements to become a doctor? So, first, you need to have an undergraduate degree. This is basically what's called as the premed. So, coming from high school, you cannot directly go to med school unless you qualify in something called a BSMD. So basically, it's a shortcut to med school. In order to qualify, you have to be really smart. In the Philippines, there are ways. The BSMD equivalent in the Philippines are as follows. So we have LeapMed from UST, or University of Santo Tomas. That's the oldest university in Asia, and also recognized for being one of the best med schools in the Philippines. So yes, this is highly sought after, but unfortunately, so many applicants are not able to qualify. If I'm not mistaken, even after passing the exams, although yes, exam passers are usually less than 100 people, but after that, there's still a chance for you to be exempted from qualification because there's an interview afterwards. So yes, I know this person from YouTube also. He did pass the LeapMed exam, but he failed the interview, so it's sad. But yeah, for UP, there is something called the IntarMed. This is basically the same thing as LeapMed, but it's under the control of UP. or University of the Philippines, Manila, UPM. For De La Salle, they also offer something called BS Human Biology. It's also a shortened medical track. Um, basically, after 2 years, yeah, but yeah, you study for 2 years at their campus in Manila. That's in Taft Avenue. And by your third year and onwards, you move to Dasmariñas. That's in Cavite. So yes, I during my De La Salle application, I did consider going BS Human Biology, but I thought it was better to not take the shortcut. And besides, going to Dasmariñas just to study med school isn't necessarily a good thing when um, UST Med School as well as UP Med School, um, pamantasan ng lungsod ng Maynila, and UARM and UE, as well as Ateneo School of Medicine and Public Health. They're basically all within the Metro Manila area, and this is just really far from my place. So, yeah. Um, Going back. So yes, an undergraduate degree is important. If you're a Filipino who wants to pursue med school in the US, um, it's said to be better to start your pre-med or to graduate your pre-med in the country where you intend to get your medical license. So, for example, let's say in Australia, it's not just limited to Australia though. So there's this university there called James Cook University. So basically, they offer a variety of pre-med programs. One of them is nursing, which only takes 3 years. Nursing science, I think that's what they call it. So this is 3 years in duration. There is BS Pharmacy. BS, by the way, is Bachelor of Science. Although, yeah, this is said to be an honors course. I think this is standard in Australia. All of the pharmacy courses are a quota course, or in other words, an honors course. So it's more difficult to get in. Therefore, in the submission of your requirements, your credentials, your high school transcripts, your SAT score, although that's already deemed optional recently, um, especially your IELTS score, basically the English standardized exam to test how proficient you are in English. So, yeah, you just have to make your application stand out in order to have a higher chance of qualifying in an honors course, such as BS Pharmacy. And yeah, just to mention, also, um, considered an honors course, there is something called engineering. I'm actually surprised when I was looking at the courses offered in their website relating to engineering. I think there's only one or two courses on engineering. Maybe it's because James Cook University isn't that big on engineering, but yeah, what I'm saying right now may not be as credible because I did not research enough in that regard. So, yeah, undergraduate degree, all doctors must earn a bachelor's degree on a pre-med track. Um, any, if you're asking what kind of pre-med is best, it's actually debatable. Um, Although the most common, um, I think, the most common pre-med track or course that's taken is in the field of biological sciences. So we have BS Biology. Um, so yes, something related to that. BS Biochemistry, BS Chemistry, BS Physics, or pre-med Physics in particular. That's offered in the Philippines, but in the US, I'm not sure. But definitely, pre-med courses in the US are much better. Um, so, much better in the sense that if you plan to apply for a US med school, um, they'll see the name of the US university, and you definitely have a way higher chance of being accepted compared to if those admissions people see your credentials, the fact that you graduated pre-med coming from a foreign university, particularly in the Philippines. Say you graduated from UP, uh, or UST, or the LSU, and Ateneo. Basically, these four universities are already the most prestigious in the entire country. So, even so, they usually say that it's really difficult to qualify to med school coming from a different country where you took your pre-med. So, just to give you some information, sorry about that. Okay, so this is usually the case according to someone who um, is in the US, based in the US, however, studied college in Ateneo, that is in the Philippines. So, particularly in the first paragraph that you're seeing, it says this is why also why many Filipino doctors who migrate to the US do so as nurses, because their credentials are worth less, despite being very good doctors. So, um, coming from there, it's really difficult to qualify for med school in the US. Or in another case, if you want to move to the US, but you're already a doctor, you graduated med school and residency perhaps here in the Philippines, but when you get to the United States, you start from the bottom. And yeah, there are instances where um, Filipino international medical graduates, or IMGs, are able to be successful in getting a medical license in the US. However, it takes more time to reach that goal. So let's say it takes around 10 years to um, get your medical license here in the Philippines. When you get to the US, you'll have to study a few more years. So yeah, it's just being unfair in that regard. You're gonna study more, way more than 10 years. And 10 years isn't a joke. It's already a big part of your life. Um, your peers who are engineers, lawyers, and those in other professions are already working, and you're still studying. So, yeah, especially if um, you need to take on the USMLEs, the licensure exams, basically, in the US. They will not accept your license, your Philippine medical license. Even if you have already taken the PLE, this is the Philippine counterpart of the USMLEs in the US. This is the Philippine licensure exam. So, um, so it takes usually 4 years to complete, but yeah, in Australia, nursing only takes 3 years. So after completing the undergraduate degree, this is where you take the MCAT to demonstrate knowledge to prospective med schools. So the MCAT in the Philippines, it's usually equivalent to the NMAT. NMAT is the National Medical Admissions Test. That is, you have to score really high in this exam in order to like bolster your resume, make your resume stand out when applying to a Philippine med school. But in the US, it's called the MCAT. Same thing. But yes, if you're a Filipino who graduated pre-med in the Philippines, in the US, they say that you have almost zero chance to take the MCAT. And this is why. Sorry, I think it's in this website. So this is from US News. So this is how international pre-meds can find a med school. That's basically the title. So in the second paragraph, it says, many US medical schools do not consider applications from international pre-meds, no matter how impressive their credentials are. So yes, since they reserve all the seats in their med school class for domestic students, so basically they prioritize their domestic students more than international applicants. So yeah, basically it's best to start your pre-med in the US if that's where you want to get your license, or perhaps in Australia. I believe in Australia the restrictions are less strict, the guidelines basically. Sorry about that. Hang on. So according to admissions experts. So even schools with admissions policies that allow international students to rarely accept these students. But yeah, nevertheless, international students do occasionally attend US med schools, so pre-meds applying from outside of the US should do careful research to find out which schools are open to international students. So yeah, it's not as necessarily an easy path. Uh, yeah, no matter how impressive your credentials are, it's gonna be really difficult. So just to be realistic, start pre-med there as much as possible. The cheap tuition fee here in the Philippines is not worth it. Usually the case in the US is that even domestic students are not able to pay student loans, but the name of the university is what medical schools usually look for. So yeah, it's more regarding the name than um, anything else. Even if, let's say, you're a Filipino doctor and you compare yourself with a US doctor, usually they're the same in what they do. However, um, yeah, it's just the education credentials that admissions people really look for and consider. Anything else out of that, unfortunately, is not that considered, not considered as much. So after pre-med or undergraduate degree, you go to med school. So apply using AMCAS and attend. So that's particularly in the US lang. Only in the US. So this is another 4 years of studies. You complete coursework to prepare you for work within the field. So usually in the last 2 years of med school, you do clinical rotations, although it can vary from med school to med school. So in clinical rotations, you gain first-hand experience providing patient care. So if the last 2 years of med school is going to be more on clinical rotations, the first 2 years will be more on a lot of studying. Usually during med school, perhaps during your, well, actually, I'm not sure about this, but um, within these 4 years, you take on the USMLE Step 1, Step 2 CKE, Step 3. Um, those are basically the equivalents, again, of the PLE in the Philippines. So, two-part curriculum, general coursework, and studies devoted to chosen medical specialty. So, I'm not sure how you'd eventually match in a specific specialty, although you can choose. Um, I think your credentials will still dictate where you would best match. So, yeah, sorry about that. Number three, after graduating med school, you go for residency. In the Philippines, I think this is optional. However, if you take on residency anyways, it's basically going to, um, again, make your credentials stand out. So yeah, residency, in other words, is called internship. It usually takes 3 to 7 years depending on your specialty. Of course, if it's primary care, you usually only get 3 years of residency. You only spend 3 years in residency. For specialists such as neurosurgeons and plastic surgeons, they usually take 7 years in residency. So yeah, you delve deep in your specialization. You provide direct care in a medical setting firsthand. And residency in the US in particular is necessary, unlike in the Philippines. And yeah, it's flexible. So, total average of years of study after K to 12, this, by the way, is basically from kinder to grade 12, primary, secondary school. It takes 11 to 16 years depending on the length of your residency. So, um, choose a short residency after completing 8 years of med school and an undergraduate degree. So, this is only in the case of primary care physicians, such as family doctors. So, what are the considerations? Of course, the competitiveness of the specialty and residency program lengths. These are important to consider. And just to enumerate some specialties with the shortest residency programs, these in particular are ones that caught my attention. So, family medicine, 3 years only. Ophthalmology, 4 years. This, by the way, is the specialty that um, a renowned Filipino hero pursued during his time. He is Dr. Jose Rizal. He pursued ophthalmology at UST, the University of Santo Tomas. That was 200 years ago, roughly. Um, okay, we have psychiatry, 4 years. Pediatrics, 3 years. Internal medicine, 3 years. And yeah, the least competitive residency programs are family medicine, pediatrics, and psychiatry. Usually, primary care physicians are the most underpaid, but going back to the salary from earlier, this is already pretty big for um, Filipinos. But of course, you have to account for taxes. It's also a big problem in the U.S. But being a doctor, it's not. It shouldn't really be much of a problem. Everyone pays taxes, and uh, for physicians in particular, I suppose that these people are able to still live properly even after taxes. So yeah. Um, so after residency, you have to get board certified. You obtain certification that pertains to your medical field. So there are this is in Filipino, but basically in English it's translated as there are 24 specialty boards that certify doctors. So you acquire this by passing another exam. So obtain your licensure. So this is particularly in California. So in each U.S. state, there are specific requirements. So yeah, afterwards you start practicing medicine. So let's get back to the undergraduate degrees or pre-med experience. So you need one or more degrees. They basically should be backed up by science courses and a doctorate in medicine to qualify for med school. So these are the pre-med programs usually. So microbiology, immunology, behavioral science, physiology, genetics, biochem. BS Bio, Org Chem, economics. Although it's kind of weird, there are certain um, doctors who mentioned about their pre-med degrees being engineering or particularly biomedical engineering. This is actually still technically called a pre-med degree. But what's a lot more weird is basically other physicians mentioned that um, their pre-med degrees were natured on statistics and mathematics. So yeah, at some point they were able to qualify to med school. And according to Med School Insiders, according to the data that they presented in their video, these pre-med graduates did not necessarily do worse compared to those who took on biological science natured pre-meds such as BS Bio. Actually, those who studied humanities, uh, math, and statistics scored higher in the MCAT. At least that's what they said. So yeah, I hope I delivered that information as accurately as possible, although I've watched that video a long time ago. So we have economics, exercise science, foreign languages, philosophy, physics, psychology, religion, sociology. And there's another popular pre-med in the Philippines. It's called BSMT or Bachelor of Science, BS, in Medical Technology. So what are the pros or advantages of medtech? So if you want to pursue a doctorate right after, this is a good choice. And the number of, I don't really get this, but uh, I think it has to compare something with registered nurses or RNs. What are the disadvantages of BS Biology? So, BS Biology, some say that it's a useless degree. That is, in a certain light, true if you won't pursue further studies afterwards. So, you won't really find a job anywhere if you only graduate with a BS Biology degree. That's why they say that BS Biology is the perfect pre-med if you are really sure to pursue med school, or not just really limited to med school, other medical professions, um, medical related professions such as PA, physician assistant, uh, and yeah, among other things. So this particularly is from Kevin Jubbal, Med School Insiders. So family medicine doctor, primary care, patients of all ranges. Family medicine is the center of primary care. They're basically generalists of generalists. Okay, so in a family medicine clinic, this is the main input into the healthcare system, and this clinic is designed to address non-urgent health concerns. And for a family med physician, they receive treatment or um, patients receive treatment or they are referred to a specialist for more complex pathologies. So, for the majority of family med physicians, they practice in outpatient clinical settings. Usually, the pathologies that they deal with are as follows: diabetes, hypertension. This is basically, in other words, high blood pressure, high blood, uh, somehow associated with atherosclerosis and coronary heart disease in a certain extent, uh, although not so limited to them. We have hyperlipidemia, preventive medicine, and health screenings. So, as a family med physician, you will never have as many procedures as a surgeon. So, we have some things that family med physicians do are steroid injections, wart removal, colposcopies, vasectomies. This is, by the way, um, for I'm not sure. I think it's a form of contraceptive, so that the male won't be able to reproduce anymore. We learned this in uh, grade 12 biology. Um, and unfortunately made a mistake in that. The vasectomy, yeah, anyways. Frenulectomy, circumcisions. So circumcisions in Filipino, this is called tule. So you can also tailor patient population. So you focus on pregnant women delivering babies, older patients through geriatrics. You keep it broad. You address all patients from cradle to grave. So for internal medicine, this is somehow comparable to family med. That's why it's kind of relevant. Um, so internal medicine is only for adult patients. Cardiology, gastroenterology, infectious disease. So fellowships usually last 3 years. Family medicine is a family physician is a generalist with various 1 year fellowship options. So, um, yeah, this is a lot more to cover. Okay. I think everything is kind of repetitive already. Not all, but some of them. But yeah, let's still continue. So let's compare a general family doctor with a specialized family doctor. For general, they work in an outpatient clinic. They have not completed the fellowship. Fellowship is what usually comes after residency, and it's optional already. They focus on preventive health and yeah, simple concerns. So this is for the broad population, regular working hours 9 to 5, and the compensation is relatively low. So for specialized family medicine doctors, on the other hand, they are fellowship trained and their lifestyle depends on the specialization. So there are certain specializations such as sports medicine. So they meet athletes. They're usually those who um, are doctors for NBA players in particular. For instance, obstetrics, they deliver babies, similar to the work of OB/GYN specialists, as as well as emergency medicine. So, EM doctor, if you like to pursue a fellowship in the field of emergency medicine, being able to perform well under pressure, then yeah, go emergency medicine. Academic practice versus community practice versus private practice. So these are the three kinds of practices that you could pursue as a family med physician. So community practice is the most common. For instance, Kaiser Permanente. So this is being a family medicine physician. Um, so not primary responsibilities are research and teaching. Let's go to academic practice. So they handle patient care. They teach med students and residents. Actually, this is something that is done by a relative of mine. He's older than me, but he's my nephew. Um, he is, well, in the future, he's gonna be a former educator at the University of Santo Tomas, second and third year medical technology students or medtech students. So yeah, in a certain way, he works in an office. So I think his case falls under this kind of practice. So they tend to some research responsibilities, and yeah, they have the lowest compensation, as at least in the United States. But we all know that in the Philippines, the salary is way lower. Private practice. So this is the least common of the three. It offers the most flexibility. You're your own boss, the compensation is relatively high, and there's more hassle and longer hours, um, because this is usually equivalent to running a business, particularly a sole proprietorship, because it's you who's running the business. The services that you provide is based on what you have studied for roughly 10 years. So you don't pay a doctor um, for what they do um, in a typical checkup. You pay them for being able to master what they do in that particular time span for roughly a decade. So, yeah, relating to something that Elon Musk said, um, in terms of paying by the hour. So, truths. Family medicine doctors are some of the best when it comes to handling common presenting concerns. And yeah, they're specialists of complexity, quarterback of the patient's healthcare needs. So, quarterback is in the context of football, although it's not usually familiar in the Philippines. Maybe the context is understandable for Americans. Even I don't really understand the meaning of quarterback, but yeah. They know a little about everything. And that's the reason why they retain so much knowledge that they studied in med school. Once they reach, once they study the field of family med. So, so what do family doctors do? They find conditions that allow for early intervention, and they handle complex situations where a patient is receiving multiple treatments. So flexibility, these are the following uh, things that that a family med physician can take up. So yeah, this was already mentioned earlier. Residency is categorical, match into one program and complete all 3 years. So the intern year is already included here. So for intern year, PGY1, you'll rotate on many services. This one, PGY1, is um, exclusive in the US. This is what they usually call it. So you work on obstetrics, pediatrics, internal medicine, and um, ICU. What's ICU? Intensive care unit. Yeah, I remember. And PGY2, PGY3, they still rotate on various specialties, and they're usually dedicated to rotating on your own specialty services. So we have gynecology, emergency medicine, general surgery, cardiology, sports med, orthopedic outpatient, something related to the bones, dermatology, the skin, geriatrics, old age, psychiatry, um, yeah, and trauma. So doctors need to know what they can handle on their own, and they should also know at the same time what they should refer out or request a specialist consult for. So yeah. Family medicine competitiveness, the match rate is 96%. It's really high. And for the USMLE Step 1, the average is supposed to be 220 in terms of your score. I think this is the kind of score that you have to reach if you want to match to family med. So this should be one of the easiest scores to um, score. The USMLE to step 2 CK, average of 236. So competitiveness is relatively low, it's just 13%. And yeah, what's the stereotype for family medicine? So it's for those who love everything, especially during their third year rotations, except surgery, of course. They could not find themselves committing to one specialty at the exclusion of others. So yeah, again, they're generalists. They get a little bit of everything. So after 3 years of family medicine residency, you can choose to specialize with an optional fellowship. So it usually lasts 1 year. So these are the fellowships. What are the advantages of family med? Um, so there's great flexibility. You can deliver babies all day. Your schedule is desirable. It's a 9 to 5. It's very common. The 9 to 5 is very common for white collar jobs in the US and in other countries as well. So, um, family med is in the context of having a pager. That's basically a device that usually calls you. If they need you in the hospital, you have to go there right away, regardless of where you are. So, you get called the least. So, yeah, you get to sleep better at night. You don't have to wake up in the middle of the night just to respond to a pager. There's great access to longitudinal care, and you maintain a broad knowledge on medicine. You spend thousands of hours of incredible effort learning about the various organ systems and their pathologies, only to forget much of it as you narrow down with your specialty. I think this is exactly what Dr. Kevin Jubbal said in his video. So, yeah, you don't have to learn something new, and yeah, at the same time, at the expense of somehow losing the medical knowledge that you have already studied in med school now that you're in residency and fellowship. So let's go to the disadvantages of family med. So the compensation is relatively low compared to other specialists. The average is 236,000. I think for neurosurgery it's around 500,000. So yeah, just to give a proper comparison to justify why family med physicians have the lowest compensation. So the average compensation of specialist physicians is usually 344,000 per year. Of course, after residency, your salary would eventually increase, and that would continuously increase as you age, so until retirement. So there's a lot of charting, a lot of computer work, documentation, and billing. So family med physicians juggle social issues with patients, and that specialty is often looked down upon because, again, usually family med is the easiest. So, yeah, you don't exactly have the respect of everyone in the field. So, family medicine is for you if these things appear to be a green flag for you. So, you're the medical student who went through third year and loved everything non surgical. You wanted to maintain a broad knowledge of organ systems, and you want a work life balance. So, qualifications, you have to score well on class tests and standardized exams. As you look at resources, companies to work with, seek out actually MD physicians, no one else who didn't go to medical school. So, these MD physicians are supposed to have, as much as possible, stellar results in exams and positive ratings from patients or customers. So, yes, these are my sources, by the way. So, yeah, again, like what I said earlier, the NMAT is the entrance test to med school in the Philippines, and it's called the MCAT in the US. So, yeah, these are the common pre-med degrees: nursing, medtech, pharmacy, biology, and physical therapy. Pharmacy is 5 years, by the way. Medtech is 4, nursing 3 in Australia, 4 here in the Philippines. I think it's also 4 in the US. Biology, 4 years. Back then, it was 5, but it became shortened in a way. Physical therapy, I'm not sure. So, okay, let's compare the MCAT and the USMLE. So, if the MCAT is the entrance test to med school, the USMLE is the test required for medical licensure in the US. So, you have to, this has to be passed by doctors who desire to practice medicine in the US. So, coming from the Philippines, you actually have to pass this. This is actually true in the case of someone from YouTube with the name Doc Aura. She actually started med school. She graduated as a physician here in the Philippines, but when she moved to the U.S., she wanted to pursue a license there. It was extremely difficult. Actually, right now she is in South Dakota, if I'm not mistaken, and she is a family physician. She studied pre-med at De La Salle University, BS Bio. I'm not sure though which major, if it's systematic psychology, medical, or microbiology, if I remember right. But yeah, afterwards, she moved to PLM, or Pamantasan ng Lungsod ng Maynila. And yeah, she moved to the US. I'm not sure what med school she applied to when she got to the US, but yeah, that's basically it. She started um, studying for pre-med in the Philippines like over a decade ago. She just graduated recently, so yeah, it's a really long journey. But it could all be easier if you started pre-med in the US. It's going to save you a lot of stress, save you from a lot of stress and heartbreaks. So for the NMAT, the duration is usually 3 hours for part 1, 2.5 hours for part 2. The results they're released in 15 working days. So that's for the Philippines. Okay? Okay, that's it for this video. I hope um, this video has been useful, although I think it's pretty long. I hope you learned something from this. Thanks for watching.